Good afternoon, everybody. I am Dr. Gother, and I am coming to you from Muscat, Oman. Now, what I want to discuss today is what is the difference between typical autism and Asperger's. Both of them do follow now under the autism umbrella, but let us talk about what is the difference in these two different diagnoses. Now, Asperger's is no longer a standalone diagnosis like it used to be, but it's important to understand the difference between the typical autism diagnosis and an Asperger's diagnosis. Learning the difference between the typical autism and Asperger's can help you decide on how you will approach treatment for your child. For over 70 years, doctors treated Asperger's as its own diagnosis. Many professionals believed that Asperger's was a more mild form of autism, hence the origin of the phrase high-functioning autism. Now, these days, children with Asperger's symptoms are more likely to be diagnosed with autism-spectrum disorder. Their symptoms are typically on the very mild side, but every child experiences symptoms differently, hence the word spectrum. Autism spectrum disorder features a wide range of symptoms and experiences. As Dr. Stephen Shore has stated, who happens to be on the spectrum himself, if you have met one child with autism, you have met one child with autism. For example, some children with autism spectrum disorder are nonverbal. They have mini stems. They may have a very low IQ. They might have behavior issues. But on the other hand, others have superior IQs, maybe have a little bit of social issues, and don't have the stimming and behavior issues that come along with typical autism. No matter what the symptoms are, it's important to get treatment for your child as soon as possible. Early intervention is one of the surest and best ways that your child will develop the necessary life skills and learn how to become independent. Doctors used to think Asperger syndrome as a separate condition by itself, completely separate from autism. Because Asperger's is associated with less severe symptoms, good language and cognitive skills, doctors issued this diagnosis for many years. Asperger's was first identified by an Australian doctor named Hans Asperger in 1944. Hence, we have the name Asperger Syndrome. He noticed that some children with autism had better developed social and motor skills, fewer speech problems, and also better cognitive skills than their peers that were on the autism spectrum. He identified these children as having a condition similar to autism, but undeniably unique and different from autism. Today, children experiencing developmental delays and symptoms and characteristics of autism are instead most likely to be diagnosed with autism spectrum disorder, because autism is a broad category of developmental disorders that share similar symptoms. Now, this being said, Many parents and individuals on the lower end of the spectrum, meaning those that are more high functioning, still prefer the phrase Asperger's because of the stigma still surrounding the phrase autism spectrum. Many others, however, especially professionals, believe that this change is beneficial, as an autism diagnosis is more inclusive and reflects the fact that autism develops with a wide range of characteristics and symptoms. You'll have one person on one side that is mild and another person completely on the other side that is very severe. The principal difference between typical autism and Asperger's is that Asperger's features milder symptoms and an absence of severe language delays. Most children who were diagnosed with Asperger's have good language skills, but may have difficulty fitting in with their peers. They may feel uncomfortable, they may feel awkward, but their language skills are usually good. Now, children with typical autism, on the other hand, typically exhibit major problems with speech and communication. They may have a problem understanding what somebody is saying to them. They may have lots of stimming going on. They may have meltdowns, behavioral issues. Now, children with typical autism also frequently exhibit repetitive behavior. They also exhibit a rigid language as well as narrow topics of interest. For example, maybe they like cars. They always want you to buy them cars. Every time you go to the shop, they want a car. If they're verbal, maybe they can tell you about different makes of cars, different models, when they were made, and so on. Now, another difference between typical autism and Asperger's is in the cognitive functioning. By description, a person with Asperger's cannot have a significant cognitive delay that is usually seen amongst children with typical autism. Children on the lower end of the spectrum, meaning those that are high functioning, have an average to above average intelligence, while children on the higher end of the spectrum, which is the more severe cases, usually have a significant cognitive delays. For example, a child with typical autism may have difficulty recognizing and responding appropriate to others' thoughts and feelings. They may have difficulty recognizing their parents. They may have severe meltdowns. Another difference between typical autism and Asperger's is the age in which children receive a diagnosis. Now, the average age for a diagnosis with children with typical autism is between the age of 18 months to 4 years old. Now, children with Asperger's or high-functioning autism usually are not diagnosed until they are a teenager or sometimes even into adulthood. This is probably because children with Asperger's do not exhibit language delays or have lower IQs. Many parents do not realize that their child has a developmental delay until they start school and they start social interactions. And then they go in and they're having trouble communicating with peers. Now, learning about the difference between the different types of autism, Asperger's versus typical autism, is very helpful, but taking action is even more important. I encourage all parents to seek treatment for their child as early as possible. Early intervention provides the best opportunity for children to learn valuable independent life skills. Thank you for listening, and I hope you have a great day.